In this mini lecture, we will look at some of the assessments that are used to diagnose autism. A screening tool is a brief assessment that is used to identify infants or children that are at risk of or may have a developmental delay. A screening tool is simply something that may indicate a problem. It is not directly a tool that is used to diagnose something alone. In general, these screeners are norm referenced, which means they are comparing children to peers of the same age. They're competency based, and this means that they are based on a skills and a progression of skills. They may use interviews and observations in order to determine the level of competence of a child on various skills. And then an important aspect of these screening tools is that hearing screenings are used to rule out hearing loss as any type of factor that could be affecting communication or behavior. There are various categories that look at some of the characteristics to identify autism spectrum disorders from other developmental disorders. In particular, these categories look at a child's ability to use eye gaze or follow a particular stimuli when it's presented, orient to their name or attend to a speaker when they call their name. So this could either be looking up or looking at the direction of a speaker. The ability to point or show things that interest them. This could be a preferred toy or another preferred item. The ability to play, and in particular, pretend when playing. The ability to imitate a speaker, either in speech or action. Their ability to attend and understand nonverbal communication. This is reading body language or reading expressions. So this could be, how can I tell if someone's angry or if someone is happy? And finally, language development. Previously, autism was not diagnosed before a child was 3 years old. Now we have some early screeners that can help predict if a child has autism, and these can be used in toddlers and children below the age of 3. Some of these early skills are the checklist for autism in toddlers. This is known as the CHAT, the early screening for autistic traits, or the ESAT, and the first year inventory, or the FYI. You can take a look at some of these screeners in the resources section in this module. The childhood screeners, or those that are used a little bit later, either after a child is 3 or when they're in a school setting. There is the CARS and the GARS, which is very popular, the Childhood Autism Rating Scale and the Gilliam Autism Rating Scale. The DISCO, or the Diagnostic Interview for Social and Communication Disorders, and then the ADI and the ADAS. We're going to look specifically at the ADI and the ADAS because these are two of the most widely used and accepted tools, and these are things that you may very well have to fill out or review as a teacher when a child is being evaluated for autism spectrum disorders. The ADI, or the ADI-R, which stands for revised, is a standardized, semi-structured interview protocol that consists of 93 items. These items are broken up into 3 specific domains, and each of the domains relate to one of the 3 characteristics of autism. So this falls into social skills, communication and language, and then repetitive, restrictive, or stereotypical interest or behaviors. The information that is presented also can be used for treatment planning. So this can help us discover if a child has overactivity or self-injurious behavior, which would need to be addressed in a child's program. Within the domains, these questions are broken up into various categories. First, there's some introductory information where we ask about a child's demographics, including age, gender, and some cultural background. Then we ask about early development, as well as some prenatal questions. Then we get into verbal and nonverbal communication skills, social development and play, a child's interests and behaviors, and finally some things that fall into general behavior questions or those related to executive functioning. So this could be memory skills, motor skills, and a child's over or under activity. The ADOS, or the Autism Diagnostic Observation Schedule, is based on, again, communication, social interaction, and play or behaviors. And this is, instead of interviews, an observation protocol. And this gives an assessor, usually a psychologist, a script to follow and things to look for during an observation. It consists of 4 modules, and each of these modules is related to a specific age bracket, or for children who are school age, the level of verbal fluency. So the toddler model is given to children who are over the age of 1 and below the age of 3. And modules 1, 2, and 3 are generally for school age children who are in either early intervention programs or elementary school. Modules 3 and 4 are for middle school and older, and for highly verbally fluent children. Or module 4, we have adults can be assessed using this module. Within the testing protocol, some materials are provided to see how a child can do various tasks. In addition to the materials that are provided, sometimes preferred materials can be brought in to see how a child engages with some familiar toys as well. Some of the sample activities are featured on this slide. In your resources section, you can see some of the subtests that are provided in one of the ADOS assessments as a parent discusses her journey for her child's diagnosis with autism. I recommend that you watch that short video clip so you can see how this test is given. Now that you're familiar with some of the screeners used to detect autism in children, I want you to take a look at what is used in your school district or your school by psychologists to screen for autism. In addition to asking some of these questions, I'd like you to be sure to explore some of the resources which feature sample reports as well as videos which show some of the testing protocols as they're being implemented.